Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists nurse practitioners with employment contract and independent contractor agreement issues. Today I'm talking about nurse practitioner non-compete clauses. So what are some things you need to think about, some red flags, and then how you should structure it to set you up for the maximum flexibility when the contract is terminated. All right, so first thing to do, you got to identify the state that you're in and what the laws of your state are. I review contracts from everywhere, and really the only thing that changes on a state to state basis, nearly everything else is completely standardized nationally, is the non-compete. And there are some states where they are completely unenforceable. There's only a handful of those at this point. Whereas in most of the other states, there's some kind of reasonableness standard. There have been a few states lately that have actually codified what they consider reasonable. Like Texas, for instance, this summer, had a physician law that says it can't be more than, I think it's 1 year and 5 miles from the primary practice location. Whereas other states might consider, 1 year and 2 locations and 10 miles to be a reasonable amount. So identify what the current state laws are in your where you're going to practice, to make certain that you're not being asked to sign something that's completely unenforceable. All right, so we have hopefully established what the laws in your state are, what is generally in a non-compete. It has 3 components: the scope, the time, and the geographic restriction. So scope meaning what you can't do during the restricted period, which the restricted period is how long it lasts. And then obviously the geographic restriction is just simply where you can't practice in. So some nuances for all 3 of them. And this is the most important one for a nurse practitioner, is the scope. If you're an NP, you can do lots of different things. And so although you may have gravitated to a subspecialty or something like that, you don't want in your non-compete it to say you can't practice as a nurse practitioner for 1 year and 10 miles from your primary practice location. You want it to be specific to the employer. So if you are working in an ortho clinic, you want it to say you can't work in orthopedics as a nurse practitioner, for 1 year and 10 miles. If you are in primary care, then you need to say primary care, so that'll allow you to do urgent care or be a hospitalist or work in the ED. So you just don't want it to say that you blanket can't work as a nurse practitioner. It's pretty hard for an employer to argue that, if you're a hospitalist, it's actually insane to have a non-compete for them. You're not competing for patients. No one's going to go to a hospital specifically for a hospitalist. You're not taking anything away. So there's no justification for it. And the same could be said as if you're working in nephrology and you're going to go to a primary care clinic. There's no competition between the two. So making the scope limited to what you're doing specifically for that employer is important. I have seen some that say you can't even practice nursing, not just be a nurse practitioner. So even if you wanted to take, I know most don't, but some NPs will still pick up some RN shifts, PRN if they want. And so you just have to make sure that language is limited. Now, time-wise, no more than a year. Sometimes you'll see 2 years in a contract. That's pretty, frequent, but no more than a year is what I would accept. You won't really get less than that, but 1 year is a reasonable amount. And then as far as the geographic limitation, this one can be tricky as well. If you're just in, one outpatient clinic, and you're doing primary care and you never work anywhere else and you don't have privileges anywhere, you're not doing any rounds, it's very simple. It's just that location. 5 to 10 miles would be a reasonable amount from that location. Now, if you're in a practice that has multiple locations, that's where it gets tricky. So you don't want the language to say the 10 miles applies to every single location of the employer. You want to limit it to one, wherever you've worked. So if they have 10 locations in a city, and you've only worked at 2, then you don't want it to be 10 miles from 10 locations. You would just want it to be from the 2 locations where you provided care. And then also, you want to limit that look back period. And let me explain it. So you want it to say anywhere you've worked in the last 12 months. Sometimes you'll see language in the contract that just says anywhere you worked while employed. So let's say you've been with an organization for 8 years, and in year one, you filled in at a clinic, 40 miles away just because somebody was sick. Well, you don't want the 10-mile restriction to attach to that location that you worked at 8 years ago. So you want it to be anywhere you've worked in the last 12 months, not anywhere you've worked at for the employer, forever. The whole point of this is to just give you flexibility when the contract terminates, so you don't have to move, or you're just like out of luck trying to find something. Anybody can work, for a year doing something else. Yes, it's not ideal, but if it's either you have to move or you just do urgent care for a year, that's a decision that's kind of easy for some people. So, all right, that's a little bit about non-competes for nurse practitioners. If you have any questions about your employment contract or independent contractor agreement, feel free to contact my law firm at the information listed below in the description. And I appreciate you watching the video. All right, thanks. Take care.